Hi, everyone. This is Nurse Anna from nursestudy.net. This is Management of Care Nursing NCLEX Questions and Answers. This was a request from a subscriber named Marlene. Thank you, Marlene, for your request. 50 questions with answers and rationales. So let's get started. Before I forget, if you would like free audiobooks on ACX or Audible for nursing NCLEX questions, go ahead. There is a link in the description below. Enjoy the questions.
Question 1. A nurse is preparing to administer medication to a patient who has refused it. The patient is alert and oriented. What is the most appropriate action for the nurse to take? A. Administer the medication regardless of the patient's refusal. B. Document the refusal and notify the healthcare provider. C. Leave the medication at the bedside for the patient to take later. D. Persuade the patient to take the medication despite the refusal. Answer: B. Document the refusal and notify the healthcare provider. Rationale: patients have the right to refuse medication. The nurse should document the refusal and notify the healthcare provider to ensure proper follow-up and adjustment of the care plan if needed. Question 2. A patient undergoing chemotherapy expresses a desire for euthanasia due to severe pain. What is the nurse's best response? A. I can provide you with the means to end your life if that's what you want. B. You should speak to your family about your wishes. C. Let's discuss ways to manage your pain and improve your comfort. D. It's illegal for me to assist you with that request. Answer: C. Let's discuss ways to manage your pain and improve your comfort. Rationale: the nurse should address the patient's pain and discomfort, offering support and discussing pain management options. It's important to provide compassionate care while adhering to ethical and legal standards. Question 3. A nurse is delegating tasks to a nursing assistant. Which task is appropriate for delegation? A. Administering oral medications. B. Performing a sterile dressing change. C. Assisting a patient with ambulation. D. Developing a nursing care plan. Answer: C. Assisting a patient with ambulation. Rationale: nursing assistants can assist with basic tasks such as ambulation, as long as they are within their scope of practice. Tasks involving medication administration or sterile procedures should be performed by licensed nurses. Question 4. A patient with a terminal illness has a do not resuscitate (DNR) order. The patient's family insists on performing CPR if the patient stops breathing. What should the nurse do? A. Follow the family's wishes and perform CPR. B. Follow the DNR order and not perform CPR. C. Contact the healthcare provider for clarification. D. Wait for the patient to stop breathing before deciding. Answer: B. Follow the DNR order and not perform CPR. Rationale: the DNR order is a legal document that indicates the patient's wishes regarding resuscitation. The nurse must follow the DNR order and not perform CPR, while also providing emotional support to the family. Question 5. A nurse is supervising a newly licensed nurse. The newly licensed nurse administers the wrong dose of a medication. What is the supervising nurse's priority action? A. Report the incident to the nurse manager. B. Document the error in the patient's chart. C. Assess the patient for any adverse reactions. D. Reprimand the newly licensed nurse immediately. Answer: C. Assess the patient for any adverse reactions. Rationale: the immediate priority is patient safety. The supervising nurse should assess the patient for any adverse reactions to the medication error and provide appropriate care. The error should then be documented and reported according to facility policy. Question 6. A patient with advanced dementia is unable to give informed consent for a surgical procedure. Who should the nurse contact to obtain consent? A. The patient's healthcare provider. B. The patient's spouse or legal guardian. C. The patient's adult children. D. The patient's primary nurse. Answer B. The patient's spouse or legal guardian. Rationale: in cases where a patient cannot give informed consent, the nurse should contact the patient's legal guardian or designated healthcare proxy, typically a spouse or family member, to obtain consent for medical procedures. Question 7. A nurse is caring for a patient who is a Jehovah's Witness and refuses a blood transfusion. The patient is bleeding heavily. What should the nurse do? A. Administer the blood transfusion without the patient's consent. B. Respect the patient's wishes and notify the healthcare provider. C. Attempt to persuade the patient to accept the transfusion. D. Contact the patient's family to overrule the patient's decision. Answer B. Respect the patient's wishes and notify the healthcare provider. Rationale: patients have the right to refuse treatment, including blood transfusions. The nurse should respect the patient's decision and notify the healthcare provider to discuss alternative treatment options. Question 8. A nurse is working in a facility where a new healthcare law has been implemented. The nurse is unsure how the law affects patient care. What is the best course of action? A. Ignore the new law and continue with current practices. B. Ask a colleague for a summary of the law. C. Review the new law and attend training sessions offered by the facility. D. Wait for the nurse manager to provide instructions. Answer C. Review the new law and attend training sessions offered by the facility. Rationale: it is the nurse's responsibility to understand and comply with new healthcare laws. Reviewing the law and attending training sessions ensures the nurse is informed and can provide care that aligns with current legal and regulatory standards. Question 9. A nurse witnesses a colleague using a patient's identification number to access the patient's medical records without permission. What should the nurse do? A. Confront the colleague immediately. B. Report the incident to the nurse manager or appropriate authority. C. Ignore the incident to avoid conflict. D. Discuss the issue with other colleagues. Answer B. Report the incident to the nurse manager or appropriate authority. Rationale: unauthorized access to patient medical records is a violation of HIPAA regulations. The nurse must report the incident to the appropriate authority to protect patient privacy and confidentiality. Question 10. A nurse is providing education to a patient with a new diagnosis of type 2 diabetes. The patient expresses difficulty understanding the information. What is the most appropriate action for the nurse to take? A. Provide written materials for the patient to read later. B. Refer the patient to a diabetes education class. C. Simplify the information and use teach-back techniques. D. Continue with the education as planned. Answer C. Simplify the information and use teach-back techniques. Rationale: the nurse should simplify the information and use teach-back techniques to ensure the patient understands the education. This method helps verify comprehension and allows the nurse to address any misunderstandings. Question 11. A nurse is assigned to care for a patient with a history of substance abuse who is in severe pain. The healthcare provider orders a higher than usual dose of pain medication. What should the nurse do? A. Administer the medication as ordered. B. Question the provider about the appropriateness of the dose. C. Administer a lower dose based on standard protocols. D. Refuse to administer the medication. Answer B. Question the provider about the appropriateness of the dose. Rationale: it is important to verify the appropriateness of a higher than usual dose, especially in patients with a history of substance abuse. The nurse should communicate with the healthcare provider to clarify the order and ensure safe and effective pain management. Question 12. A nurse is caring for a patient who has expressed a desire to leave the hospital against medical advice, AMA. What is the nurse's best course of action? A. Restrain the patient to prevent them from leaving. B. Attempt to convince the patient to stay. C. Document the patient's decision and notify the healthcare provider. D. Allow the patient to leave without informing the healthcare team. Answer: C. Document the patient's decision and notify the healthcare provider. Rationale: the nurse should respect the patient's autonomy, document the patient's decision to leave AMA, and notify the healthcare provider. The patient should be informed of the risks associated with leaving and provided with any necessary information for follow-up care. Question 13. A nurse observes that a colleague has falsified a patient's medical record to cover up a medication error. What is the nurse's ethical responsibility? A. Confront the colleague and demand an explanation. B. Report the incident to the nurse manager or ethics committee. C. Ignore the situation to avoid getting involved. D. Correct the medical record and notify the patient. Answer: B. Report the incident to the nurse manager or ethics committee. Rationale: falsifying medical records is a serious ethical violation. The nurse must report the incident to the appropriate authority, such as the nurse manager or ethics committee, to address the issue and uphold the integrity of patient care and documentation. Question 14. A nurse is caring for a patient with limited English proficiency. The patient requires informed consent for a surgical procedure. What is the best action for the nurse to take? A. Use family members as interpreters. B. Provide written consent forms in English. C. Request a professional medical interpreter. D. Use nonverbal communication to explain the procedure. Answer: C. Request a professional medical interpreter. Rationale: it is essential to ensure that the patient fully understands the information being provided. Using a professional medical interpreter ensures accurate communication and helps the patient make an informed decision about the procedure. Question 15. A nurse is providing care for a patient with a psychiatric disorder who expresses a desire to harm themselves. What is the nurse's immediate priority? A. Provide emotional support and listen to the patient's concerns. B. Ensure the patient has no access to harmful objects. C. Document the patient's statements and notify the healthcare provider. D. Contact the patient's family to discuss the situation. Answer: B. Ensure the patient has no access to harmful objects. Rationale: the immediate priority is the safety of the patient. The nurse should remove any potentially harmful objects and then notify the healthcare provider to implement further interventions, including psychiatric evaluation and possible hospitalization. Question 16. A nurse is caring for a patient who requires a blood transfusion but has a documented history of severe allergic reactions to blood products. What should the nurse do? A. Administer the transfusion with close monitoring. B. Notify the healthcare provider and discuss alternative treatments. C. Premedicate the patient with antihistamines and steroids. D. Refuse to administer the transfusion. Answer: B. Notify the healthcare provider and discuss alternative treatments. Rationale: the nurse should notify the healthcare provider about the patient's history of severe allergic reactions to blood products. Together, they can discuss alternative treatments or preventive measures to ensure the patient's safety. Question 17. A nurse is caring for a patient with a chronic illness who expresses a desire to make an advance directive. What is the nurse's role in this situation? A. Provide the patient with legal advice regarding advance directives. B. Direct the patient to an attorney to draft the document. C. Provide information about advance directives and assist the patient in understanding the options. D. Create the advance directive for the patient. Answer C. Provide information about advance directives and assist the patient in understanding the options. Rationale: the nurse's role is to provide the patient with information about advance directives, answer any questions, and assist in understanding the options. The nurse should not provide legal advice or draft the document but can facilitate access to resources. Question 18. A nurse is caring for a patient who is a minor and requires surgery. The parents disagree on whether to proceed with the surgery. What is the nurse's best course of action? A. Perform the surgery based on the parent's consent who agrees. B. Delay the surgery until both parents agree. C. Consult the hospital's legal and ethics team for guidance. D. Ask the patient for their consent. Answer C. Consult the hospital's legal and ethics team for guidance. Rationale: in cases of disagreement between parents or guardians, it is important to consult the hospital's legal and ethics team for guidance. The team can provide recommendations based on the patient's best interests and legal considerations. Question 19. A nurse is caring for a patient with an advance directive that specifies no extraordinary measures should be taken if they are unable to breathe on their own. The patient's family requests intubation and mechanical ventilation. What should the nurse do? A. Follow the family's wishes and prepare for intubation. B. Respect the patient's advance directive and notify the healthcare provider. C. Ignore the advance directive and the family's wishes. D. Provide the family with information on the patient's condition and options. Answer B. Respect the patient's advance directive and notify the healthcare provider. Rationale: the advance directive represents the patient's wishes for their care. The nurse should respect the advance directive and notify the healthcare provider, explaining the situation to the family and providing support. Question 20. A nurse is working in a rural community clinic and encounters a patient who requires specialized care not available at the clinic. What is the nurse's responsibility? A. Attempt to provide the specialized care, despite the lack of resources. B. Refer the patient to a specialist or facility that can provide the necessary care. C. Inform the patient that they cannot receive the care they need. D. Suggest the patient seek care at a larger hospital on their own. Answer B. Refer the patient to a specialist or facility that can provide the necessary care. Rationale: the nurse's responsibility is to refer the patient to a specialist or facility that can provide the necessary care. It is important to ensure the patient receives the appropriate level of care, even if it is outside the current facility. Question 21. A nurse is caring for a patient with a diagnosis of severe depression who has been prescribed an antidepressant. The patient refuses to take the medication, stating they don't believe it will help. What is the best action for the nurse to take? A. Administer the medication covertly. B. Respect the patient's decision and document the refusal. C. Encourage the patient to take the medication by explaining its benefits. D. Notify the healthcare provider of the patient's refusal. Answer C. Encourage the patient to take the medication by explaining its benefits. Rationale: the nurse should educate the patient about the benefits and potential effects of the medication, addressing any concerns or misconceptions. However, the patient's autonomy should be respected, and the healthcare provider should be notified if the patient continues to refuse. Question 22. A nurse is caring for a patient who has been diagnosed with a contagious disease. The patient is requesting to be discharged against medical advice, AMA. What is the nurse's best response? A. Allow the patient to leave without further discussion. B. Restrain the patient to prevent them from leaving. C. Explain the risks to the patient and the public, and notify the healthcare provider. D. Contact the patient's family to persuade them to stay. Answer C. Explain the risks to the patient and the public, and notify the healthcare provider. Rationale: the nurse should explain the risks of leaving AMA, both to the patient's health and to public safety. The healthcare provider should be notified to provide further guidance and potentially involve public health authorities if necessary. Question 23. A nurse is caring for a patient with an advance directive that includes a DNR order. The patient's condition deteriorates, and the family requests resuscitation. What should the nurse do? A. Follow the family's wishes and initiate resuscitation. B. Respect the DNR order and explain the situation to the family. C. Contact the healthcare provider to override the DNR order. D. Ignore both the family's wishes and the DNR order. Answer B. Respect the DNR order and explain the situation to the family. Rationale: the nurse must respect the patient's DNR order, as it reflects the patient's wishes for end-of-life care. The nurse should communicate compassionately with the family, explaining the legal and ethical implications of the DNR order. Question 24. A nurse is caring for a patient with a mental health disorder who has been involuntarily committed. The patient demands to be released immediately. What is the nurse's responsibility? A. Release the patient immediately as requested. B. Ignore the patient's request and continue with the treatment plan. C. Inform the patient of their rights and the legal process for involuntary commitment. D. Contact the patient's family to discuss the situation. Answer C. Inform the patient of their rights and the legal process for involuntary commitment. Rationale: the nurse should inform the patient of their rights and the legal process involved in involuntary commitment. It is important to communicate the patient's rights and the reasons for the commitment clearly and empathetically. Question 25. A nurse is providing care for a patient with a history of domestic violence. The patient expresses fear of returning home after discharge. What should the nurse do? A. Advise the patient to avoid discussing their situation with anyone. B. Notify the patient's family to ensure they can provide a safe environment. C. Contact social services and provide information on local shelters and resources. D. Discharge the patient without addressing the concern. Answer C. Contact social services and provide information on local shelters and resources. Rationale: the nurse should contact social services to ensure the patient has access to resources and support for a safe discharge. Providing information on local shelters and resources helps the patient make an informed decision about their safety and well-being. Question 26. A nurse is caring for a patient with a recent organ transplant who is on immunosuppressive therapy. The patient expresses interest in receiving a live vaccine. What should the nurse advise? A. You can receive live vaccines without any concerns. B. Live vaccines are contraindicated for patients on immunosuppressive therapy. C. Live vaccines are safe if administered in a reduced dose. D. You should consult with your pharmacist before receiving any vaccines. Answer B. Live vaccines are contraindicated for patients on immunosuppressive therapy. Rationale: patients on immunosuppressive therapy have weakened immune systems and should avoid live vaccines, as they can lead to infections. Question 27. A nurse is conducting a health education session for a group of patients with chronic illnesses. Which topic is most important to include to help prevent hospital readmissions? A. The importance of routine exercise. B. Recognizing early signs of disease exacerbation. C. The benefits of a vegetarian diet. D. How to use alternative therapies. Answer B. Recognizing early signs of disease exacerbation. Rationale: teaching patients to recognize early signs of exacerbation can help them seek timely medical attention, reducing the risk of hospital readmissions. Question 28. A nurse is preparing to discharge a patient who requires home oxygen therapy. What is a key safety instruction the nurse should provide? A. You can smoke as long as the oxygen is turned off. B. Keep oxygen tanks at least 5 feet away from any heat source. C. You should only use oxygen at night. D. Store the oxygen tanks in a closed cabinet. Answer B. Keep oxygen tanks at least 5 feet away from any heat source. Rationale: oxygen tanks should be kept away from heat sources to prevent combustion and ensure the safety of the patient and household. Question 29. A nurse is caring for a patient who is receiving palliative care and has an advance directive requesting no artificial nutrition. The patient's family insists on starting tube feeding. What should the nurse do? A. Start the tube feeding as requested by the family. B. Respect the patient's advance directive and notify the healthcare provider. C. Contact the hospital ethics committee for guidance. D. Ignore both the family's request and the advance directive. Answer B. Respect the patient's advance directive and notify the healthcare provider. Rationale: the nurse must follow the patient's advance directive, which reflects their wishes for end-of-life care. The healthcare provider should be notified to address the family's concerns. Question 30. A nurse is assigned to care for a patient who is a healthcare professional and requests to self-administer their medications. What is the nurse's best course of action? A. Allow the patient to self-administer without supervision. B. Verify the medications and supervise the self-administration. C. Refuse the request and administer all medications personally. D. Leave the medications at the bedside for the patient to take later. Answer B. Verify the medications and supervise the self-administration. Rationale: the nurse should verify the medications and supervise the self-administration to ensure patient safety and adherence to the prescribed regimen. Question 31. A nurse is caring for a patient with a history of multiple drug allergies. The patient is prescribed a new medication. What should the nurse do before administering the medication? A. Administer the medication and monitor for adverse reactions. B. Review the patient's allergy history and notify the healthcare provider if concerns arise. C. Assume the new medication is safe since it is newly prescribed. D. Ask the patient to sign a waiver of responsibility. Answer B. Review the patient's allergy history and notify the healthcare provider if concerns arise. Rationale: it is crucial to review the patient's allergy history and discuss any concerns with the healthcare provider to prevent potential allergic reactions. Question 32. A nurse is caring for a patient who requires frequent repositioning due to immobility. The patient complains of pain during repositioning. What should the nurse do? A. Administer pain medication as prescribed before repositioning. B. Reposition the patient less frequently to minimize pain. C. Ignore the pain complaints and continue with the scheduled repositioning. D. Use restraints to prevent the patient from moving during repositioning. Answer A. Administer pain medication as prescribed before repositioning. Rationale: administering pain medication before repositioning can help manage the patient's pain and improve their comfort during the procedure. Question 33. A nurse is preparing a patient for surgery who has expressed concerns about the procedure. The patient asks the nurse, "What would you do if you were me?" What is the most appropriate response? A. I think you should go through with the surgery, it will help you. B. It's important to consider all your options and discuss them with your healthcare provider. C. I would do whatever the doctor recommends. D. I can't give you advice on personal decisions like this. Answer B. It's important to consider all your options and discuss them with your healthcare provider. Rationale: the nurse should encourage the patient to explore all options and discuss any concerns with the healthcare provider. It is important to support the patient's autonomy and informed decision-making. Question 34. A nurse is caring for a patient who is unable to make decisions about their care due to cognitive impairment. The patient's healthcare proxy is not available. What should the nurse do? A. Make decisions based on the nurse's judgment. B. Delay any non-urgent care decisions until the healthcare proxy can be reached. C. Seek a court-appointed guardian for the patient. D. Proceed with care decisions in consultation with the healthcare team. Answer: B. Delay any non-urgent care decisions until the healthcare proxy can be reached. Rationale: the nurse should wait until the healthcare proxy is available to make non-urgent care decisions. The healthcare proxy is legally designated to make decisions on behalf of the patient. Question 35. A nurse is assigned to care for a patient who has expressed concerns about their cultural practices not being respected in the healthcare setting. What is the nurse's best response? A. We follow standard procedures here, so cultural practices are not possible. B. Can you tell me more about your cultural practices so we can respect them during your care? C. You should follow our healthcare guidelines and not focus on cultural practices. D. I'll make a note of your concerns, but there's not much we can do about it. Answer: B. Can you tell me more about your cultural practices so we can respect them during your care? Rationale: the nurse should demonstrate cultural competence by asking about the patient's cultural practices and working to incorporate them into the patient's care plan when possible. Question 36. A nurse is providing care for a patient who has a history of non-compliance with medication regimens. The patient is now prescribed a complex regimen. What is the most effective strategy the nurse can use to promote compliance? A. Simplify the medication regimen as much as possible. B. Emphasize the importance of taking the medications correctly. C. Schedule follow-up visits to monitor the patient's adherence. D. Provide detailed written instructions and a pill organizer. Answer: A. Simplify the medication regimen as much as possible. Rationale: simplifying the medication regimen can make it easier for the patient to comply. This may include reducing the number of doses per day or using combination medications. Question 37. A nurse is caring for a patient who has been prescribed a new anticoagulant medication. The patient expresses concerns about the risk of bleeding. What is the best way for the nurse to address these concerns? A. You shouldn't worry, the medication is safe. B. It's important to take the medication as prescribed, but we can discuss ways to minimize bleeding risks. C. I can ask the doctor to stop the medication if you're worried. D. Bleeding is a common side effect, but it's not serious. Answer: B. It's important to take the medication as prescribed, but we can discuss ways to minimize bleeding risks. Rationale: the nurse should acknowledge the patient's concerns and provide education on how to minimize bleeding risks while emphasizing the importance of the medication. Question 38. A nurse is providing discharge planning for a patient who lives alone and has limited mobility. What is the most appropriate action to ensure the patient's safety at home? A. Arrange for a visiting nurse service. B. Suggest the patient move to a long-term care facility. C. Provide the patient with emergency contact numbers. D. Instruct the patient to check in with family members daily. Answer: A. Arrange for a visiting nurse service. Rationale: arranging for a visiting nurse service can help monitor the patient's health, provide necessary care, and ensure the patient's safety at home. Question 39. A nurse is caring for a patient with limited health literacy who needs to follow a new medication regimen. What is the best approach to ensure the patient understands the instructions? A. Provide written instructions with medical terminology. B. Use simple language and visual aids to explain the regimen. C. Ask the patient to read the medication labels aloud. D. Rely on the patient's family members to explain the regimen. Answer B. Use simple language and visual aids to explain the regimen. Rationale: using simple language and visual aids can help the patient better understand the medication regimen, especially if the patient has limited health literacy. Question 40. A nurse is caring for a patient who is being considered for hospice care. The patient's family is struggling with the decision. What is the nurse's role in this situation? A. Make the decision for the family based on the patient's condition. B. Provide information about hospice care and support the family's decision-making process. C. Encourage the family to choose hospice care as it is the best option. D. Avoid discussing hospice care to prevent upsetting the family. Answer B. Provide information about hospice care and support the family's decision-making process. Rationale: the nurse should provide comprehensive information about hospice care, addressing any concerns or misconceptions the family may have, and support them in making an informed decision. Question 41. A nurse is caring for a patient who has been diagnosed with an infectious disease and requires isolation precautions. The patient expresses frustration with the isolation. What is the nurse's best response? A. You need to stay in isolation to prevent spreading the infection. B. Isolation is for your safety and the safety of others. Let's discuss ways to make you more comfortable. C. Isolation is standard procedure, and there is nothing we can do about it. D. It's only temporary, you'll be out of isolation soon. Answer B. Isolation is for your safety and the safety of others. Let's discuss ways to make you more comfortable. Rationale: the nurse should explain the importance of isolation for infection control and work with the patient to find ways to make the experience more comfortable. Question 42. A nurse is caring for a patient who is undergoing chemotherapy and is at risk for neutropenia. What is the most important instruction to provide to the patient to reduce the risk of infection? A. Avoid eating fresh fruits and vegetables. B. Wash your hands frequently and avoid crowds. C. Take your temperature daily. D. Limit your fluid intake to reduce swelling. Answer B. Wash your hands frequently and avoid crowds. Rationale: frequent hand washing and avoiding crowds are crucial for patients at risk for neutropenia to reduce the risk of infection. Question 43. A nurse is caring for a patient with a new tracheostomy. The patient and family are anxious about caring for the tracheostomy at home. What is the nurse's best approach to education? A. Provide detailed written instructions and videos. B. Demonstrate tracheostomy care and allow the patient and family to practice with supervision. C. Schedule follow-up visits with a respiratory therapist. D. Reassure the family that the home health nurse will handle all care. Answer B. Demonstrate tracheostomy care and allow the patient and family to practice with supervision. Rationale: hands-on demonstration and supervised practice help build the patient and family's confidence in managing tracheostomy care at home. Question 44. A nurse is caring for a patient with a chronic illness who frequently misses appointments. The patient expresses difficulty with transportation. What is the most appropriate action for the nurse to take? A. Arrange for transportation services to ensure the patient can attend appointments. B. Suggest the patient rely on family members for transportation. C. Ignore the issue, as it is beyond the nurse's control. D. Advise the patient to move closer to the healthcare facility. Answer A. Arrange for transportation services to ensure the patient can attend appointments. Rationale: arranging transportation services can help the patient consistently attend appointments, ensuring continuity of care and better health outcomes. Question 45. A nurse is caring for a patient who is scheduled for a high-risk surgery. The patient is concerned about the potential for complications. What is the nurse's best response? A. There is always a risk of complications, but the surgery is necessary. B. It's normal to be concerned, let's discuss your concerns and what the surgical team will do to minimize risks. C. You should not worry, the surgical team is very experienced. D. Complications are rare, and you should focus on the positive outcomes. Answer: B. It's normal to be concerned, let's discuss your concerns and what the surgical team will do to minimize risks. Rationale: acknowledging the patient's concerns and providing information about the measures taken to minimize risks helps build trust and reduce anxiety. Question 46. A nurse is caring for a patient with a new diagnosis of diabetes mellitus who has poor literacy skills. What teaching strategy is most effective? A. Use complex medical terminology to ensure accuracy. B. Provide verbal instructions with simple language and visual aids. C. Give the patient detailed written instructions to read at home. D. Ask the patient to repeat the instructions back to you. Answer: B. Provide verbal instructions with simple language and visual aids. Rationale: verbal instructions using simple language and visual aids can help the patient better understand the necessary information, especially when literacy skills are limited. Question 47. A nurse is providing care for a patient who has been diagnosed with terminal cancer and is experiencing significant pain. The patient expresses a desire to discontinue all treatments and receive only palliative care. What is the nurse's role in this situation? A. Persuade the patient to continue with curative treatments. B. Ensure the patient is fully informed about the implications of their decision and support their choice. C. Refuse to discontinue treatments as it is against the healthcare provider's advice. D. Discharge the patient from the healthcare facility. Answer: B. Ensure the patient is fully informed about the implications of their decision and support their choice. Rationale: the nurse should ensure the patient understands the implications of discontinuing treatment and support their decision, respecting the patient's autonomy and right to choose palliative care. Question 48. A nurse is caring for a patient with a language barrier and no available interpreter. The patient needs to sign a consent form for a surgical procedure. What should the nurse do? A. Use nonverbal communication to obtain consent. B. Provide the consent form in English and ask the patient to sign. C. Delay the procedure until a qualified interpreter is available. D. Ask a family member to interpret for the patient. Answer: C. Delay the procedure until a qualified interpreter is available. Rationale: it is essential to ensure that the patient fully understands the consent form. Using a qualified interpreter is necessary to facilitate accurate communication and informed consent. Question 49. A nurse is caring for a patient with a psychiatric disorder who has been admitted involuntarily. The patient refuses to take prescribed medications. What should the nurse do? A. Administer the medication without the patient's consent. B. Respect the patient's right to refuse medication and document the refusal. C. Try to coerce the patient into taking the medication. D. Ignore the patient's refusal and leave the medication at the bedside. Answer: B. Respect the patient's right to refuse medication and document the refusal. Rationale: even in involuntary admissions, patients have the right to refuse treatment. The nurse should document the refusal and inform the healthcare provider for further guidance. Question 50. A nurse is providing discharge instructions to a patient with congestive heart failure. The patient has limited resources and expresses concern about affording medications. What should the nurse do? A. Suggest the patient skip doses to make the medication last longer. B. Refer the patient to social services for assistance with medication costs. C. Advise the patient to use over-the-counter alternatives. D. Ignore the concern and complete the discharge process. Answer B. Refer the patient to social services for assistance with medication costs. Rationale: referring the patient to social services can provide access to resources and programs that help with medication costs, ensuring the patient can adhere to the prescribed treatment plan.